It's now time to take a look at news stories making headlines around the globe today. Now, the Nigeria Center for Disease Control, the NCDC, have confirmed 117 new cases of COVID-19 in 8 states. Now, this was announced via the NCDC's Twitter handle last night, and according to the breakdown, 59 cases were recorded in Lagos, 29 in the Federal Capital Territory, 14 cases in Kano State, 6 cases in Borno State, and 4 in Katsina. Also, 3 were recorded in Ogun and 1 each in Rivers and Bauchi states. Now, as at 11:25 p.m. on the 21st of April, there are currently 782 confirmed cases of COVID-19 reported in Nigeria. The number of discharged patients has increased from 188 to 197, while unfortunately 3 deaths were recorded, bringing the total number of fatalities now to 725. So, Doctor, here we now have a confirmed number of cases at 782. So there's an increase, but then again, testing capacity is also going up. There are concerns spreading to different states, and also the increases that we're seeing in Kano that I guess we're also going to discuss quite a lot on the show today. But what is your take on this?
Well, it's very good to see the Presidential Task Force addressing Nigerians and providing information on a daily basis. But with the figures rising up to 782, that's frightening.
Yeah.
And, well, you could attribute it that there's been improved testing up to about 5,000, we were told the last time. Now we have 782 confirmed cases. But I'm sure that if we still ramp up testing capacity, we'll still get a lot more in terms of the numbers.
Definitely, yeah.
And Kano particularly should be an area of concern because Kano started with about 1 or 2 cases, and from that it has jumped us at yesterday evening to 73 cases. And there have also been reports of mysterious deaths in Kano. About 180 persons were said to have been buried in the last 4 days. And persons have said, look, there must be something going wrong in Kano at this particular moment. And considering Kano's population, it's not something that should be taken lightly. And, you know, it was heartening to see that yesterday, the DG of the Center for Disease Control, Dr. Yekwazu, mentioned Kano, and that one of the things the Presidential Task Force is going to do is to try to investigate what exactly is going on in Kano, whether it is COVID-19 related. Because the local medical directors are saying that most of the persons who have been dying in Kano presented symptoms of malaria, diabetes, typhoid, hypertension, or even some of them died as a result of hunger. Now, that's too easy an explanation. I think there should be proper investigation.
Definitely.
And the governor of Kano State himself is already calling for help. Now, another thing that I think that the Presidential Task Force has been overlooking is a pronouncement on the Ramadan fasting season. Now, does Nigeria have guidelines for the Ramadan season? Because I think Ramadan will start in a matter of days. By now, I would have expected that either the federal government or the Presidential Task Force on COVID-19 will have said something about this. I mean, the United Arab Emirates came out this week, earlier this week, with guidelines for Ramadan. And that's the United Arab Emirates Fatwa Council. And what they have said is that, look, yes, it is Ramadan season, but you can pray at home. You don't have to keep going about.
Absolutely.
There will be no social religious gathering. 3, if you have symptoms of COVID-19, either you are symptomatic or asymptomatic, don't even bother to vote. Now, Friday prayers will be managed also differently. That's in the UAE. Now, that announcement has been made regularly, so that the people are aware. But here in Nigeria, what is the guideline for this year's Ramadan? Because, you know, there is a cultural side to Ramadan. There is also the religious side to it. People will want to eat together. They want to pray together. I expect the federal government to come out and say, yes, Ramadan is important. It's a very important religious observance. But because of the peculiar times in which we have found ourselves, can people please follow these guidelines? I think that is very important. However, it's also good that the federal government yesterday announced additional allowances for health workers. About 50% of the salaries of doctors and nurses will now be classified as the allowance. And then they will also get a consolidated salary of about 25% increment. I think that should encourage our frontline health workers who are really overworked at this particular time.
Certainly.
And I think it's also a good development that at this time of COVID-19, President Buhari has approved the payment of the 3 months' salaries being owed university teachers.
Yeah.
Because part of the conversation has been research. And Ihekweazu yesterday was talking about the universities trying to look for vaccines. Now, if we want our university teachers to be involved in the search for a cure in Nigeria,
you need to pay them.
Then, of course, we need to pay them. We need to encourage them. This is not the time to play the game, the politics of starvation.
Absolutely.
As a way of making ASUU members bend to the will of government. The outstanding issues can be resolved later.
Absolutely.
And then again, the Minister of Information at the briefing yesterday, is very important what he said. He said that in Kano, which is emerging as another epicenter of COVID-19, that some people are going about selling COVID-19 vaccine. Now, it's not enough for the Minister of Information to tell people to beware of those people selling COVID-19 vaccines. Those people hawking COVID-19 vaccines
must be found and prosecuted.
Must be arrested.
Yep.
You know, the government should make it impossible for them to mislead people or to even harm people.
Absolutely. And to be very honest with you, at this point in time, considering lockdown enforcements that we're seeing, it shouldn't be hard to find people around Kano State that are falsely selling COVID-19 so-called vaccines. And you're right, they do have to be arrested. Let's take another story also related to Kano State that we're currently discussing, because the recent rise in deaths in Kano State has been a great concern to sources of residents. Now, reports say 180 people have been buried over the past 4 days. Although the development comes at a time where the state has recorded 73 COVID-19 cases, the 3rd highest in the country to add to that, some health workers say that the deaths are not related to the disease that has claimed over 170,000 lives across the world. One source at the Murtala Mohammed Specialist Hospital, Kano, said most of the deaths resulted from hypertension, anemia, diabetes, malaria, and typhoid. Another source also attributed some of the deaths to ulcers. Meanwhile, the Kano State government says it's activated community informant structure of the World Health Organization to report deaths and causes of deaths as well, and has also deployed officers in all cemeteries to count bodies brought in for burial every day. So, Doctor, this is what you were speaking about, this sudden increase in deaths, 180 deaths in the space of 4 days. Now, of course, the great concern has to be affiliated to COVID-19, but also what we're seeing here, what you mentioned and what I just read out in the report, hypertension, diabetes, etc., those symptoms that we're seeing are also symptoms that are related to persons that we are hearing are dying of COVID-19. So you're right when you're calling for an investigation. It has to be a serious investigation into this and what is actually causing this, because really and truly, if we're looking at this situation very practically, it is also possible to say that it's possible that Kano has had an increase and a serious rise in cases of COVID-19 that have not been accounted for, and maybe this is the result. So we do have to have an investigation into this because it's of great worry.
It's good that the Nigeria Center for Disease Control, led by Chikwe Ihekweazu and his team, have been visiting the states. So it's good to see that the Presidential Task Force is not just sitting down in Abuja.
Yeah.
They have a team that is going around, and so far they've visited up to 6 states. I'd like to see Dr. Ihekweazu and his team also visit Kano State with a team to go on the ground to find out exactly what is going on. Because Kano has a large population like Lagos. In Lagos, we have 430 confirmed cases. But the question is, does Kano have the same capacity as Lagos to deal with the situation?
Thank you.
Now, if you don't have that capacity in Kano, then Kano State really needs help. Otherwise, we'll see the numbers rising exponentially. And then, of course, the federal government will have to take a decision by next Monday whether to continue to extend the lockdown, or to even shut down the entire country.
Absolutely, Doctor. And on that note, let's go on a very quick commercial break. And when we are back, the morning show continues. Stay with us. Welcome back to the morning show here on Arise News. We're now joined by our business correspondent, Rota Sodiri, for the latest headlines and updates in the business world. Good morning, Rotas. How are you doing?
Good morning, Leah. Yes, so scary times. So if you look at the headline of today's This Day newspaper, it addresses our oil price situation and how Nigeria can take advantage of it. And one thing I've been thinking about is whether or not, COVID-19 can actually push Nigeria into a period of stagflation. And stagflation is a period where you see low GDP growth, high unemployment, persistently high inflation, and also low demand. It's almost like a perfect storm. And if you look at where oil prices are, I mean, I woke up this morning to see oil prices at crude at $16 a barrel. 16. I mean,
that's scary.
Yeah, it's. We're talking about WTI the other day, and where it was at into negative region. That was for May futures. We now moved to June. June was at $20. Now WTI is at $10, and crude oil is at 16. So it is an incredibly scary situation, which is where the analysis in today's This Day paper talks about how we can possibly leverage on that. By the way, inflation is also out as well for the month of March. That's at a 23-month high, 12.26%, up 6 basis points from where we were in February. In February. Although, key thing is that the Statistician General, Dr. Yemi Kali, said that it doesn't capture the effects of COVID-19 and the lockdowns that we saw with regards to that. So we probably have to see what will happen in April inflation to see those captured, because people were talking about higher food prices. But with regards to oil, you know, the key things that the article looks at, the analysis in This Day, is one, the Minister of Finance has to reduce our benchmark a second time. I mean, we had her on, she was talking with Charles Anyagolu. I've had an interview with her where she was talking about, you know, talking about fiscal stimulus and the need to revise the benchmark. So the article looks at a reduction from $30 per barrel to $20, you know, to take advantage of the current realities. Two, the article also says that we need to pass on cost savings in this low-cost crude environment, energy savings to everyday Nigerians. PPRA, Petroleum Products and Price Regulatory Agency, has been looking too much at PMS. They have to look at diesel, have to look at kerosene, have to look at other derivatives of crude and pass on those cost savings to everyday Nigerians. Three, they got to meet up with refinery producers like Dangote Refinery and other modular refineries that are being produced, give them incentives to accelerate the production coming on stream of refineries. Dr. Abati has mentioned that with regards to how those cost savings in bringing in refined crude can be eliminated, how those cost savings can be increased by eliminating bringing in of refined crude into the country and pushing those refineries out and getting them to produce as fast as possible. And then four, the Petroleum Industry Governance Bill has to be passed.
It does.
So look, this is really scary, right? So, I mean, if you look at what we've lost in revenue going from a $57 per barrel budget benchmark to a $30 per barrel budget benchmark, you've cut that in half. Now you're going to 16, right? So, and there's no outlook for where you can see oil prices being propped up. So it's quite alarming, and thankfully
this is really dark, actually.
It's very dark, and it's something that needs to be addressed.
We're in a precarious situation. In fact, I read an article that says Nigeria, like other commodity-dependent economies, faces a Venezuela-like prospect or a Zimbabwe-like prospect, which will mean we may be witnessing the prospect of complete economic collapse. Now, let me start first with your reference to stagflation. Stagflation is a combination of high inflation and stagnant growth. And this was predicted, incidentally, as far back as October 2019, October 6, 2019, I think, by the CEO of Financial Derivatives, Bismarck Rewane, who is a regular guest on this and other programs on Arise TV. And on that occasion, he had said, well, with the prospect of a global recession looming, Nigeria also faces the crisis of stagflation. For what reasons? Our external reserves were being depleted. We faced a sovereign debt crisis. Our borders, had remained closed at the time. I mean, he was making this prediction at the time we did not even have COVID-19.
Yeah.
And it's really a very difficult situation because between 1974 and 1976, when there was global stagflation, there was very serious economic shocks. And here in Nigeria, what are we facing now? We don't have enough buffers to check external shocks. Right. So we face real difficulty in terms of demand shock, in terms of supply shocks, in terms of even the absorptive capacity of our economy. But the news analysis you were referring to, that was written by Ijoma Nwogogo, who is the MD of Arise News and former editor of This Day newspaper. But she still writes for This Day. And our main argument is that, look, instead of all of us, wringing our hands in utter helplessness and lamenting, the serious crisis that Nigeria may face later in the year, that we can turn what is happening into an opportunity.
Yes.
We can turn it into a learning opportunity. Because what we're paying for is the vulnerability of our economy, our failure to put the right policies in place, and our failure to manage the oil sector in particular with great efficiency. So she's now saying, okay, what can be done in the interim? Well, with oil prices, dipping, and Melekari says, well, we don't need to worry. Those are paper figures, and that, Nigeria's Brent crude is not affected. I read something like that. No, he's just probably trying to
assuage fears.
Yeah, to assuage fears.
Yes.
The reality is that we're in serious trouble.
Yeah.
And so all those points you listed, Ijoma is asking for a rethinking of what we have. Now, for example, one of the points you made, which you didn't identify, is a privatization of the NNPC. And there are many people who are saying, look, the NNPC as presently constituted is not working. It's organized for inefficiency. NNPC is in upstream, is in downstream, is into retail. Can you just take one part of it and concentrate where it can be efficient? Two, local refining is part of our problem. We take our we produce, we export, and then we go and buy refined gasoline and bring it back. And then the joint ventures agreement, she also made that point. We will need to take a second look at it. So a cocktail of issues, and I like our optimism that something can be done.
Right.
And the Petroleum Industry Governance Bill, she thinks this is also the time to look at it. But who will do it? Who will listen? Because the problem in Nigeria is that you can give all these suggestions,
but nobody
will
listens.
listen to you.
Rosus, thank you
very much,
for these necessary updates, and we will see you tomorrow. That is all on this segment of the morning show, and we're back. Aaron Akerajola, sports analyst, will be here to give us the latest and overnight developments in the world of sports. Stay with us. Welcome back. Aaron Akerajola joins us now, and actually he has some COVID-19 updates for us. Good morning, Aaron. How are you?
Yeah, good morning, Leila. Good morning, Doctor. We'll start it off with the worldwide figures here on COVID-19 and the latest, and looking at how things are actually going. Let's actually just bring you some of the figures, as you can actually see there on your screen, as much as possible. Most of the numbers are actually up at the moment, and cases of the virus have been confirmed globally, with the total death toll standing at 177,466 fatalities. All right, that's according to the tally by Johns Hopkins University. The United States still leads the number of cases of our country, with just over 825,000 people infected with the virus. Of course, Western Europe follows suit with Spain, Italy, France, and Germany. And the United Kingdom are all continuing to grow in the last 24 hours. What's here in Nigeria, like you rightly discussed earlier on, we now have 725 cases, with 197 of them discharged, and 25 have died.
No, in Nigeria, we have confirmed cases 782.
Okay, 82.
The correct figure is 782.
You know what is scary, though? The United States of America's figures are really, really spiking. Well, I mean, 825,000 means that, unfortunately, very soon they are going to hit 1 million cases.
Yes.
And unfortunately, without wanting to politicize COVID-19, one can only ask, what is Donald Trump's response going to be? Because really and truly, we have to expect one, and I don't think it's going to be good.
Well, President Trump has been talking about reopening businesses so that life can move on. But of course, that's his opinion. But I think what is important for leaders across the world to follow the science of it, to allow the scientists to provide guidance. But there's no doubt that at some point, the world will have to reopen.
Yeah.
And there is a sign of hope with the reports of, persons who are over 100 years in Spain, in Iran, in Italy, and even in the United States. We have an Oregon World War II veteran who at 104 also survived. That means there is hope. In the United Kingdom, there is a race to find a vaccine. And today, they will start the vaccine trials at the University of Oxford. And Professor Sarah Gilbert, who is the lead researcher, says that, well, they're hoping that by September, the vaccine should be ready. And she says she's 80% optimistic that, Britain, the United Kingdom, will probably be the first country to find a cure to COVID-19. So the major challenge before the world is having a breakthrough in terms of getting a cure, for COVID-19.
Yeah.
Not the kind of funny breakthrough that was reported in Kano, where some people are carrying a yellow substance around and calling it COVID-19 vaccine. Before you came, we said such persons should be identified, arrested, and prosecuted for exposing Nigeria to ridicule.
Yeah, because unfortunately, until we do have a vaccine, the world is not going to go back to usual. Aaron, thank you for the COVID-19 updates for today, and we'll see you tomorrow.